Good morning, everybody. In just thinking about an introduction to this presentation, I sort of thought of two words, honor and privilege. It has been an honor and a privilege to have worked with so many great Yale alumni. I didn't have the honor and privilege of graduating from Yale's program, but after moving to New Haven, I did have the honor and privilege of working with many Yale graduates. I've also had the honor and privilege to work with many Yale students as a mentor since 1995, and most recently as a faculty member here since 2005. And so I think it's an honor and privilege to present some of this data that represents what our Yale graduates have done in the last 40 years. So we sent out a survey to all of our graduates who had email access or we had a mailing address. Non-responders were reminded with a postal card, and hopefully next week we will be sending out some more reminders to improve the response rate, which at present is 28%. And after chatting with Marianne Ramos last night, I realized that she might know somebody in New York or New Jersey who could help improve our response rate if the mailing doesn't work. So, well, maybe I should say, New York or New Jersey, right? Just a little bit about the gender of our respondents. Again, the majority being female, and that would be about 63% female and 37% male, and I think that represents the class composition, at least for the past 6 years that I've been at the Yale PA program. So we have to figure out what the men are doing. For graduates in clinical practice, when asked what they have done if they've practiced after clinical training, 97% have practiced in some clinical setting. And the states represented via responses from the survey, I think there were about 36 states that we had respondents from and 14 with no responses. So we'll have to check to see if they have email and if the Postal Service is still delivering to those states. All right. And for our representation from responses by year, I guess we'll have to send a kudos out to the class of 2003, who is the winner so far. Any 2003 graduates out there? No? Okay. All right. So maybe 2002 is the next winner. Any 2002s? All right. There we go. I remember the class of 2002 very well. All right. So when asked about what type of practice setting the Yale graduate practiced in, and looking at the data, a majority of graduates have practiced at one point in their career in the hospital setting at about 76%. The questionnaire said that one could respond to one or more than one practice setting. So about 18% have practiced in rural or community health centers. 25% have at one time practiced in a physician practice, 52% in a group practice. For the other 15%, that has been comprised of settings like urgent care, retail clinics, hospital emergency departments, outpatient hospitals, industry, and of course, corporation. For the type of practice that our graduates have practiced in, about 50% of our respondents have at one time or another practiced in primary care, followed by 40% in emergency medicine, 10% in surgery, 33% in surgical subspecialties, and 20% in internal medicine or internal medicine subspecialties, with 6% in pediatrics.
David, is your definition of primary care here the same as the previous speaker's definition?
Yes. Mm-hmm. That is correct. And for 34% of other respondents, that has included areas, dermatology, urgent care, occupational medicine, HIV medicine, gastroenterology, hepatology, et cetera. So we're pretty much covering all the options. As far as leadership roles in clinical practice, about 36% of our graduates have pursued some form of leadership role after graduation. And the majority of our graduates, about 84%, have participated as supervisors of PAs. So they've taken on very much a leadership role in their careers. 35% have been chief hospital or practice PAs. 10% have been directors of research. 11% have been directors of quality assurance, and 52% have had some other form of leadership role, including office or practice administrators, clinic supervisors, director of in-office labs. They've been leaders in education, and also clinic managers. As far as leadership roles in state societies, almost 17% of our graduates have pursued a role in their state organization. And as you can see, a majority of those folks have, of those respondents, about 16% of the respondents participated in leadership roles, and 66 of those, the most common was a committee member. And 10% said that they had participated in the foundation of the state society. 52% had been committee chairs, and about 56% were board of directors, and 36 became PA State Society presidents. So that's a pretty remarkable number. And we hope to continue that trend of leadership. As far as leadership in a specialty society, 6% of our graduates have pursued that role in their postgraduate career. Although this is a new trend, it's not surprising that most respondents have participated as a committee member. That's been about 80% of those respondents, and 37% were committee chairs, 50% were board of directors, and 44% were specialty society presidents. And almost 13% had founded the specialty society. And then leadership roles within the AAPA. 6.6% of our graduates have had some form of leadership role in the American Academy of Physician Assistants, and the most common participation role has been in the House of Delegates at 82%, which I think is a pretty astounding representation for Yale. Other categories that sort of ranked higher, committee or council member or council chair, and also board of directors. And we have a few, looks like a few founders, or one founder of AAPA. Well, there could have been two that participated, right? For NCCPA leadership roles, we've had about 2% that have participated in our NCCPA organization. 83% were committee members, 67% were or have been test item writers, 33% board of directors, and 33% chairpersons of the board. As far as no one has yet founded the AAPA, the NCCPA. For participation in PA education, we've had 69% of our graduates have in some way, shape, or form participated in PA education. The most common role in participating in PA education has been via a clinical preceptor, and obviously a vital role to the continuation of the profession. So kudos to all of you who participate in PA education. And then the next most common role is a faculty member. At 18 or almost 19% of our graduates have participated in, at some point in time as a faculty member part-time, and 10% full-time. 6% of our graduates have gone on to become program directors, and 0.5% have been deans in their respective programs. 45.7% have been clinical instructors in small group organizations. For participation in the Physician Assistant Education Association, 2.6% of our graduates have had a role as either committee chair or committee member or board of directors. And I believe our last category is community involvement, which represents about 24% of our graduates have expressed some participation in community leadership roles such as community activist, health department consultant, patient educator, and the list goes on. There's a very large list of community activism amongst our Yale graduates, which speaks to the fact that we're not only taking care of patients, we're leaders in our state chapters, in our national chapters, but we're also leaders in our communities. So kudos to those participating in their communities. So just to conclude some of this data, most of our Yale graduates have chose to practice clinically at some point in their career, about 97%. Yale graduates have had many leadership roles in many organizations, including the AAPA, which actually was not reported, and that was an N of 2. And being that part of our mission here at Yale to foster leadership, again, we plan to continue that role here as well. 69% of Yale graduates have been involved in PA education, and again, as I mentioned, most commonly as preceptors. Nearly a quarter of all PA graduates from Yale have participated in community leadership. There have been some limitations, obviously, of this data, and the first one being the response rate, but I hope to see that number improves in the coming weeks, and obviously it would be others such as recall bias and filling out some of the survey. But any questions about the data, or yes?
Have you thought about also including as a component publications, and either as a co-author or a sole author? I think that's important, particularly when you're connecting back to the academic.
And I forgot to put it on the survey.
Great. But you still could,
Don't worry.
and Google Scholar.
Sorry, that was my fault.
Thank you.